my name is Nikki and I'm going to be irrigating this NG tube today. The first thing we want to do is verify the order. We want to make sure that the frequency, type, and amount of irrigation is all correct. And gather your equipment, which I have it already. I'm going to go ahead and wash my hands. I'm going to wash my hands, and when I go into the patient's room, I'm going to identify the patient by two means. So just ask them their name and their birthday, compare that to their wristband and the MAR. Once I'm in here, I'm going to explain the procedure to the patient, let them know that I'm going to be irrigating, and let them know what that means. When I'm in the room, provide for privacy, and go ahead. My hands are washed and clean. I'll put on my gloves. And when I'm in here, I'm going to check the tube placement to make sure it's in the stomach. And the way I'm going to measure or check tube placement is by measuring the pH. So I'm just going to unhook this. I'm just going to pull back like 10 mLs just so I can measure their pH and put it on our pH strip. Okay, if it's within around 4 or less, then we know it's in the stomach and it's acidic. If it's any more than that, like 6, then we know it's probably not in the stomach. It might be in the lungs. I'll go ahead and clamp this. Then once it's clamped and capped, I'm going to go ahead and get a new syringe, and then I'm going to put 30 mils of saline. So once I have my 30 mils of saline, I'm going to take the cap off, clamp it. I want to make sure though that I do not put it into this blue tube, which is only for air. Once my 30 mils of saline's in, clamp it, put the cap back on, unclamp it. And when I am aspirating any fluid that I have, after you put your 30 mils of saline in, after you aspirate, if you get more out than what you put in, then you know that's your output. If you get less out than what you put in, then that's your intake. All right, so this is good. I'm gonna go ahead and get a new syringe and inject about 10 mils of air into the blue vent, which should only be used for air, and hold it above the stomach. So once my air is inserted, I'm going to go ahead and reconnect this to suction on the wall. Reconnect it to suction. Then I'm going to go ahead and remove my gloves. And after that's all done, I'll just put the patient back in a comfortable and safe position, make sure that they have their call light, measure my return solution and document that, wash my hands. I'm going to go ahead and assess the abdomen to just kind of look and hear, feel what it looks like. I'm going to lift this up, inspect it, make sure there's nothing abnormal about it, no distension, and you're going to listen to all 4 quadrants. And listen for at least 2 minutes in each quadrant. If you hear bowel sounds, if you don't hear any, listen for about 5 minutes. And then you're going to just palpate, make sure the patient is comfortable and no guarding. And then you can go ahead and document and record your findings. The next skill I will be performing is just removing the NG tube. So first thing you want to do is make sure you have an order for it, and make sure when you go to the patient's room, you wash your hands, identify the patient by 2 means. So ask them their name, their birthday, and compare that to their wristband. And then you want to go ahead and provide for privacy, just pull the curtain, shut the door, explain that you're going to be taking the NG tube out. And then you want to go ahead, assess the abdomen again before you take it out. So same thing as you would with irrigating. You want to inspect first, listen to all 4 quadrants, make sure you hear bowel sounds. If not, wait for 5 minutes and listen. And then you want to palpate again to make sure everything is normal. And then you want to make sure you position the patient in Fowler's, at least 45 degrees, but it can be at least 30. Just put the head of the bed up. to a Fowler's position, and then go ahead and wash your hands. You can put on gloves. Once I have my gloves on, I can go ahead and turn off the suction. So you'll just turn off the suction and disconnect the tubing. So you turned off the suction, you disconnected the tubing, and then you can go ahead, remove the tape from the patient's nose. Before you do that, you want to make sure that you inject this with 20 mils of air. Alright, so you'll put this and inject 20 mils of air into it. Cap that back on. Then you can take the tape off of the patient's nose. Clamp the tubing. And then you can go ahead and remove the tube, but you want to make sure that you do it smooth and fast. And then you can go ahead and dispose of the tube in the trash. Go ahead and do any mouth care or oral care in their nose, make sure that's all clean. Then you can go ahead and remove your gloves and wash your hands. And then you can report and record your findings.